Hello and good morning to you, our listeners. Welcome to the second edition of our virtual event. And this month we are looking at Polycystic Ovarian Syndrome. Don't mind me, I know it's a mouthful, but so repeat after me. Polycystic Ovarian Syndrome, what we usually call PCOS. Now, PCOS is a hormonal disorder which is very common apparently among women. And some of the symptoms, again, are very similar to other symptoms of diseases in women. And so today we want to understand exactly what PCOS is. September globally is PCOS Awareness Month. So LMB decided to educate and provide information about PCOS for our followers. If you've been following our pages on Facebook and Twitter, you realize that we've been educating you on PCOS. But today, we want to engage our medical professional. We want to engage our gynecologist, obstetrician, to understand a little bit more about what PCOS is, what the symptoms are, what relationship it has with infertility, for instance, and then how it can be diagnosed and how it can be cured. And so help me welcome Dr. Francis Bilson.
Thank you.
Our indefatigable doctor, LMB doctor. We are very proud to have him. So Dr. Bilson.
And I'm happy to be here.
Dr. Bilson is a gynecologist and he's an obstetrician at the 37 Military Hospital. Doc, you're welcome.
Thank you.
He's looking very good in his...
Oh, I'm shy.
Dr. Bilson is shy. So, Doc, how are you doing this morning?
I'm very good, by grace. It's a beautiful Saturday. I love the weather. Partly cloudy, but just looking forward to be able to interact with our cherished women out there, so that we share information on Polycystic Ovarian Syndrome, PCOS.
Okay,
yes.
Great. So, let's just zoom in into the discussion. If you know anyone, a friend, invite a friend, a family member to come listen to this discussion, especially if somebody is going through infertility. Some of the symptoms we'll talk about, I mean, there are things that we should be aware of so we can have proper diagnosis and treatment. So, Doc, my first question, and I know that's what everybody wants to know, what is PCOS? What is Polycystic Ovarian Syndrome?
Okay, so Polycystic Ovarian Syndrome is, we normally say PCOS for short. It's a hormonal disorder frequently found in women. About 15 to 25% of reproductive women, or about 1 to 2 in every 10 women, will experience this condition in their lifetime. It normally starts in the second and third decades of life. So most often it might start just pre-puberty, the adolescent period, but most often women in their 20s and 30s are those who complain about it. And it's a combination of factors. The woman may have irregular menstrual cycles. So for instance, the woman might have cycle length that lasts more than 35 days. The usual cycle is between 21 to 35 days. Every woman fluctuates from time to time. The average is 28 that we normally talk about, but anything between 21 to 35 is okay. So a woman might have cycles that last longer than 35 days, but some women can even go beyond 4 to 6 months without them getting their menses. Wow. That's one of the signs of polycystic ovaries. Because there are other issues that could cause that, but we are talking specifically about Polycystic Ovarian Syndrome today. The other thing that the woman may have is signs of high male hormones, the androgens, and it's particularly related to the pathology related to the Polycystic Ovarian Syndrome. What happens is that in women who have Polycystic Ovarian Syndrome, they tend to have high insulin resistance. In other words, their tissues do not respond very well to the insulin that is produced. So, and there are a lot of tissues apart from insulin controlling sugars. Insulin affects the group of other tissues in the body.
Okay.
So now what happens is that because it's resistant, message is sent back to the pancreas that look, there's not enough insulin. So they produce more insulin. So there's this state of high insulin, at the same time, state of insulin resistance. So it leads to high production of androgens or male hormones. So the women tend to express features of high estrogen, androgen levels or testosterone and all the other androgens talk of. So such women will also have things like facial hair. Some will have beard, a lot of bodily hair. They also have what do you call it, male pattern baldness.
Oh,
in
wow.
very severe cases, and then it's also commonly associated with acne. So you see acne on their faces and the rest. In severe cases, again, you see on their skin very dark spots. Yes, so all these things are manifestations of it. And then the last one, because it's a criteria they use, normally there are 3 symptoms, either the irregular menstrual cycles, the features of high male hormones, and then the third one is the visualization of small follicles on a scan, what we call polycystic ovaries. Now, what happens is that because the eggs are not released, they get crowded in there on the ovaries. So you normally see them like if someone has arranged beads in a circular manner. It looks beautiful. Unfortunately, I didn't bring anything for us to see today. So this is how polycystic ovarian pictures will look like. So any 2 of them that a woman has, after physical examination through the history and then the scan and the rest, any 2 of them qualify to diagnose a woman with polycystic ovarian syndrome.
Yeah. Wow. Can we come back to the androgens?
Yes,
so if we have, I know a couple of women who have facial hair, so they need to wax a beard or wax a mustache, or they need to wax their legs. So anybody who has a lot of hair on their face, their legs, their limbs, can we automatically say then that they are likely to have PCOS?
The likelihood that they have PCOS is very high. There's an association between those who have this facial hair, acne, and all that sort of stuff, and 50% chance that they may be diagnosed with polycystic ovarian syndrome. But the other thing is that there are other things that could cause facial hair to grow. We have some tumors or cancers like adrenal glands that produce androgens. That could always do that. But what normally you can also use to detect the difference, even clinically, is that in polycystic ovarian syndrome, the symptoms are gradual. So the hair changes are gradual, the voice changes are gradual compared to the ones that are due to cancers, in which is sudden onset. And then the voice changes, another male pattern behavior is sudden onset compared to those who have polycystic ovarian syndrome. That's by the way, anyway. Yes.
Wow. Okay. I know that there are different types of PCOS. Can you explain in very layman's terms?
Okay. So the types is normally due to the severity of the polycystic ovarian syndrome. For instance, there are some women who will just have, they still have regular menses. They have, regular menses, all right. They don't have facial hair and all those sort of stuff. Then you realize that they go to do a scan and then you find out that they have polycystic ovaries. So in terms of grading, and then there are some women who have not just in terms of grading up to the most severe spectrum, in which they have both the androgen levels and features of high androgen level. They have polycystic ovarian syndrome, they have insulin resistance, and then they have infertility issues. So the types are just like that. On a more academic note, the types are normally between type 1, type A to type D. But just to break it down, it relates to the severity of the symptoms that the woman has as a result of the polycystic ovarian syndrome.
Let's break that one down a little bit, because you spoke about infertility, you spoke about insulin resistance. So then we are gearing into diabetes.
Yes.
Okay, so let's start with infertility. So at what grade are you likely to face infertility? Are there some specific symptoms of PCOS when you have, then it's likely that you would go through infertility?
Okay. So the first thing you should look out for, if you don't have regular menstrual cycles, then you should take note of it as a woman. Normal with apps and trackers now, most of you are able to tell even how many days your tracking system is. So if your menstrual cycle persistently is beginning to go beyond 35 days, normally it starts slowly that way, then you should take note. If you've been having what you call menstrual cycles that are less than 9 menstrual cycles in a year,
Okay.
less than 9 menstrual cycles in a year, then you should take note that you may likely have polycystic ovary that may be impacting on infertility. To get pregnant, you have to release an egg. The egg gets fertilized. In polycystic ovaries, you don't necessarily get ovulatory cycles. And that is why it delays beyond the 35 days.
Please, what does that mean if you don't have ovulatory cycles?
It means, simply put, you have your cycles all right, but you don't release eggs.
Oh, wow. How does that happen?
So what happens is that because of the hormonal changes that occur, and then remember the ovarian hormones to change. We have some ovarian hormones that become imbalanced, and those hormones normally work in concert to allow ovulation to take place. So when there's that imbalance, normally it's all called the luteinizing hormone compared to the follicular stimulating hormone. So it actually affects the pulsatile nature in which the brain and the ovaries coordinate to allow ovulation to take place. So that system is taken away.
Okay.
Now, they bleed not because they've had an ovulation. They bleed because the lining of the womb has become so thick that the blood vessels from the womb can no longer support it. So finally, they end up shedding. So the second thing you'll notice that beyond the irregular cycle, eventually when your cycles come, they are very heavy. The menstrual flow will be very heavy, and it takes an usually longer number of days for it to stop. Because we know the usual days is between 2 to 7 days. But because the lining of the womb has built up for so long a time, you have a lot more to shed. So the menses is very heavy, and then it takes a longer number of days for them to stop bleeding as well. Yes.
Wow. And so if you have these, irregular cycles and you are bleeding heavily and all of that, how that it's likely that it's linked to if you have PCOS, it's linked to infertility.
Yeah.
Is there a possibility of a cure then? I mean, we'll come to that, but is there a possibility of a cure when you have infertility due to PCOS?
Oh, definitely. As you said, we'll come to that. So I just touch on it briefly. But yes, infertility and PCOS is something that is treatable. It's something that will still allow a lot of women to be able to take home babies. Normally what happens is that you want to give them some medication that provoke these dormant ovaries to be able to release eggs.
Okay.
And there are several range of medications that a woman can have to be able to do that. But we have to remember that in infertility, it's not just about ovulation alone. You need a competent sperm. You need a competent pathway from the vagina through the cervix, through the uterine cavity, through the tubes, so that both the sperm and the eggs can meet for fertilization to take place. So definitely when a woman is having infertility, even when you diagnose the woman with polycystic ovarian syndrome, you have to go out to check the other causes of infertility to be sure that they are all normal before you say that this is the one due to polycystic ovary. So that when you are treating, you know what your treatment goals are and all that sort of stuff. But yes, it does impact fertility negatively. And women need to take note when they have these irregular menstrual cycles and all that sort of stuff to go to the hospital. Definitely polycystic ovary is not the only cause of it. There are other causes. But again, because we know that about 15 to 25% of women will get it, it is good that you go to the hospital to go through a thorough examination and investigation to really confirm and rule out what exactly the issue might be.
Okay, so we are discussing polycystic ovarian syndrome. It is PCOS Awareness Month in September, and so we are sharing information and educating our followers on what PCOS is. And Dr. Bilson has just been giving us some insights on what it is, the different types, and how it connects or how it relates to infertility. And so far we have learned that, look, if you have a lot of acne, if you have irregular menstrual cycles, and if you are having a lot of hair, facial hair, mustache, beard, if you have hair on your limbs, a lot of it, that could probably mean that you are producing male hormones, and that is also a symptom of PCOS. And we just spoke about how it is connected to infertility. So, Doc, how do you then diagnose fully? How am I sure that this is PCOS? You know, I have a little hair here, and when I asked you, you said, this is nothing. Okay. So which one is something? How do you diagnose PCOS?
So the diagnosis is based on the combination of three criteria: the symptoms that you come with, the androgen levels that you have, or features of the androgen symptoms you have, and then a scan that will normally diagnose whether you have the polycystic ovaries or not. So we don't need all three to be present to say that you actually have polycystic ovarian syndrome. You need just two of the three. So either hyperandrogenism, that's high androgen levels, together with polycystic ovaries, constitutes a diagnosis.
Okay.
The delayed menses you get beyond 35 days and above, and ovarian polycystic ovaries constitutes a diagnosis. A combination of just the high androgens and irregular cycles alone also constitutes a diagnosis.
Wow.
So based on that, you can get diagnosed with polycystic ovarian syndrome so that you can be managed. Let me say that 30% of women will have polycystic ovaries without having polycystic ovarian syndrome.
Oh, okay. Please explain.
All right. So what is that? You incidentally do a scan and find out that the woman has polycystic ovaries, but the woman doesn't have high androgen levels or features of high androgen levels, or the woman doesn't have any menstrual irregularities. So 30% of women, you will see them having this polycystic ovary, but that doesn't mean that they have polycystic ovarian syndrome. So again, you might see hair on somebody, but the other two might be normal. That doesn't constitute polycystic ovarian syndrome.
Okay.
You need two of the three features: irregular cycles, high androgen levels and their features, and then a scan that confirms the small follicles, at least more than 12. Normally we say more than 12. Or when the volume of the ovary is more than 10 cubic centimeters, then you say it's a polycystic ovary. So these are the criteria that you use. But each standing alone does not constitute a diagnosis, but two of any of the three will constitute a diagnosis for polycystic ovarian syndrome.
Great. And that means that we do need to go to the doctor and confirm.
Yes, you need to see your healthcare provider.
You cannot sit at home. Please don't sit at home and say that I have PCOS. It just might not be PCOS.
Yes.
You get a clinical diagnosis of PCOS. Doc, are there some ethnicities that are more prone to PCOS? I mean, we know, for instance, that fibroids, are is a disease that affects more black women. Yeah, that are more common in black women. Is it same with PCOS, or it's general?
For PCOS, not really, it's general. But what is more important is about the familial nature of it. If you have first-degree family relatives who have it, then your chances of also having polycystic ovarian syndrome is very high. With your mother, you stand about a 30% risk of having polycystic ovarian syndrome. And if you have a sister who has polycystic ovarian syndrome, you stand a 40% risk of getting polycystic ovarian syndrome. There are other things like obesity that is associated with polycystic ovarian syndrome. Probably not because the obesity themselves might be causing, but because of the physiology around the polycystic ovarian syndrome, high androgen levels, more insulin being produced, you might have a risk of actually developing obesity. But women who have these symptoms with obesity stand more than a 60% chance of being diagnosed with what? Polycystic ovarian syndrome.
Okay, let me understand this. So I am growing up as a young girl. I am not obese yet. Okay. Do I develop PCOS, and then as a result of PCOS, I develop obesity, or I am prone to PCOS because I am obese?
You are prone to the symptoms of PCOS because of the obesity.
Okay.
But also because the underlying pathology might actually increase your risk of getting obesity as well. Yeah.
And I read somewhere that when you have PCOS, it's very difficult to lose weight.
Not exactly so. You will need a lot of discipline, because indeed one of the management options we offer women is what is not medicine is better because it doesn't have any side effects. And it's amazing to know that women who just lose about 5% to 10% of their weight are likely to have their menstrual cycles coming back to normal. They are likely to have a reduction in their male hormones or androgen levels in the system. They are likely to have less features of male hormone in their system, and they are more likely to get pregnant easily. Yes, it's not easy, but this is where you need to get a dietitian involved, because losing weight, exercising as well, and promoting lifestyle changes in which you manage your diet, less carbohydrates, more vegetables, will help you to be able to live a healthy lifestyle even when you have polycystic ovarian syndrome. In women in which after all this they've done and it's very difficult and they are obese sometimes, and maybe they have pre-diabetes levels and the rest, adding metformin, the drug that is used for the treatment of diabetes, can help them to be able to have a healthy weight gain, a loss, and then maintain the weight in which they are okay for them to minimize the symptoms that they get.
So, I mean, I'm glad you raised the issue of diabetes. How is PCOS connected to diabetes? Is it something that can cause diabetes because you are producing more insulin, or what's the connection?
The pathology behind it is got to do with the fact that when you have the polycystic ovarian syndrome, your tissues tend to have resistance to insulin. So insulin is being produced all right, but because your tissues have become very insensitive to insulin, that includes the cells that deal with the production and regulation of glucose in the system. So because of that, insulin is being produced all right, but it's not being utilized because your cells are insensitive to the insulin effect. So that eventually leads you to having diabetes. Yes.
Okay. So, Doc, coming back to the issue of pregnancy, infertility, and PCOS, can you, if you get pregnant, okay, after treatment of PCOS and infertility, would the pregnancy be problematic? Are you more likely to have a miscarriage because you have PCOS, or are you likely to face some challenges in the pregnancy as a result of the condition?
Okay. So naturally, for women who have had the infertility issues, normally they would have seen a doctor. So we hope that by the time they get pregnant, the doctor would have written a plan for them. Yes, PCOS is actually associated with an increased risk of not getting pregnant. So infertility is quite high. About 1/3 of women who have it more than 60% of women who have it will still have issues with fertility. When they come, you diagnose them with PCOS. And the second thing is that it depends on your hormonal profile and how the imbalance is. But for most women, just provoking the ovaries with what we call ovulatory medications is more than enough to be able to let them get pregnant. But yes, there's an increased rate of miscarriage because the polycystic ovarian syndrome is normally associated with a higher level of androgens in the system. And that increases the risk of miscarriages in women who have polycystic ovarian syndrome. But the good news is that in women who would have been given oral contraceptive pills for some 3 months at least before they went into ovulation protocol to get pregnant, the risk is reduced. In women who have been put on metformin, and again, it's very important. Metformin is used in the treatment of diabetes, but can be used in the treatment of polycystic ovarian syndrome. And I say this because there are times you write medications for the patient and they go and then they get told that you don't have diabetes. Why is the doctor writing metformin for you to take because of this? Metformin is normally given to those who are obese and women in which you have tried to provoke the ovaries with. I'm trying very hard not to mention the medication because we are not in the clinic where when you've tried to provoke the ovaries for them to get pregnant over some number of cycles and it doesn't work, they might be resistant to that medication, what we call clomiphene citrate resistance. In that situation, adding metformin will help them. And for women who take the metformin beyond 13 weeks to about 17 weeks, when they get pregnant, it also minimizes the risk of miscarriage in them and increases the take-home rate of baby and mother going home together. So yes, though there's an increased risk of getting a miscarriage, there are a lot of things that your doctor can do to mitigate those risks to ensure that you are still able to get pregnant, but not only get pregnant, reduce the risk of you having miscarriages and hopefully be able to take your baby home.
Great.
Yes.
Okay, so we are rounding up this discussion on Polycystic Ovarian Syndrome. It's PCOS Awareness Month this September. So Live, Move, Have Your Being is educating and providing information to our online followers on what PCOS is and how it can be diagnosed and how it can be treated, especially when it has something to do with, because it has something to do with infertility. But as I said earlier, please seek a doctor's advice. Don't stay home and diagnose yourself. Okay. So, Dr. Bilson, on my own, now I have been told that I have PCOS. Is there anything I can do to lessen my symptoms outside of what the clinician would ask me to do? What can I do on my own?
There's a lot you can do in terms of lifestyle changes that will help you to be able to live a healthy living despite having polycystic ovarian syndrome. As I told you, the target is to maintain a healthy body mass index, a BMI, between 20 to 26 is okay. So weight loss is one of the targeted lifestyle changes that you could do to help you to be able to do that. The second thing is that you exercise a lot. Exercise helps in increasing the muscle activities, helps in reducing insulin resistance, and allows the insulin to be able to act on the tissues very well. So just exercise helps. So in women who already they are in a very good BMI level, but yet they have polycystic ovaries with symptoms, just exercising alone, even without losing weight, can help them to be able to have regular cycles, can help them to have ovulatory cycles, and can increase their rate of having a pregnancy. And so diet is also very important. Because of the insulin resistance, you have to know that unhealthy binging on carbohydrates and the rest might actually affect your ability to lose weight, might actually affect your risk of developing diabetes, because women who have polycystic ovarian syndrome have a higher risk of developing diabetes. So cutting down on that, dealing with more vegetables will help you to be able to manage polycystic ovarian syndrome. And amazingly, sometimes when you actually do these things, then you don't even need any additional medications to be able to help resolve the polycystic ovarian syndrome. So you realize that your caregiver will normally tell you first, let's work on this non-pharmacological methods and see whether it will work. Exercise, dietary management, weight loss. And in women, again, I told you, do the targeted BMI between 20 to 20. So sometimes just losing about 5 to 10% of your initial weight is more than enough for you to get back to regular cycles and be able to live a healthy lifestyle once you work towards the targeted BMI that you want to reach. Yes.
Okay, so you heard that you and I need to lose 5% of our weight. I have heard you, so we're going to lose some weight. And then let's exercise, let's check our diets, very important. We've been discussing PCOS. I want us to round off this discussion with Dr. Bilson's last words and his advice to all women out there and men. You know, sometimes women, we need the encouragement of men to pursue what we have to do. So, Doc, your audience.
Thank you. So all ladies out there, I want to just let you know that you are not alone, because polycystic ovarian syndrome is actually much commoner than we think. About 25% of women will have polycystic ovarian syndrome. The second thing I want to say is that it's something that can be treated for you to have a meaningful lifestyle free of the symptoms that you have. So pay attention to your system. If you notice that your menstrual cycles are beginning to go beyond 35 days, you notice that beyond the 35 days, you get heavy, prolonged bleeding after that, you may be having polycystic ovarian syndrome. If you have infertility issues and you realize that your cycles are not regular again, the infertility might just be due to the polycystic ovarian syndrome. And the third and other, when you have acne all over you, you're having facial hair all over you, don't go buying creams to resolve them. Because amazingly, we didn't even talk about the treatment for hair, those with hair, and just being on oral contraceptive pills, on some anti-androgens alone will help to resolve your issue without you going for expensive creams and all that sort of stuff. So polycystic ovarian syndrome is there with us, and it's likely that 1 to 2 out of every 10 women is going to have it. But the good news is that though it causes infertility, it causes treatable infertility. So it's something that can be managed for you to still be able to get pregnant if you're suffering from infertility. It's something that can be managed if you have irregular cycles that is not making you comfortable. And it's something that can be managed when you have high androgen levels and all those sort of stuff. So please watch your body, watch your cycles, watch your system, but make sure that you go to a health professional who can help you define whether you really have it or not and offer you appropriate treatment, because there is hope when you have polycystic ovarian syndrome. Yes. Thank you.
Great. Thank you, Dr. Bilson. So you've heard it all. Watch your cycle. If you have acne on your face, it doesn't mean that you need creams. It just might be PCOS. Okay. If you have facial hair, you're always waxing hair, it just might be PCOS. It can also cause infertility, but the good news is it's treatable. And so if you have any of these symptoms that Dr. Bilson has spelled out, please visit your clinician and let them give you a proper diagnosis and a treatment plan. And if you want to reach us for support, you can always call us on 055 614 679. Again, 055 614 679. Let me take it again. You can always reach us on 0555. There are 3 5s. 614 679. Again, 0555 614 679. We can connect you to Dr. Bilson, to medical support, and also we can support you psychologically as well. And so we have come to the end of this amazing discussion. I have learned so much. Watch out for next month. We are bringing Dr. Bilson back. He's not going anywhere.
October is breast cancer month.
October is breast cancer
it's cancer
awareness.
month for us.
Yes, it's cancer awareness month. So we'll be here again. We'll talk about breast cancer. We'll talk about cervical cancer. These are 2 critical cancers that are affecting women globally, and it's ending lives unnecessarily. So we want to talk about it and see how best we can support women. So watch out for October and join us. Follow us on Facebook, follow us on Twitter at LMB Series, and keep your questions coming in. Thank you.